Welcome. Today, we're diving into two fundamental types of study designs in clinical research: cross-sectional and longitudinal studies. Understanding these approaches is crucial for interpreting medical evidence and making informed decisions. Whether you're a student, a healthcare professional, or simply curious about how research shapes healthcare, this video will clarify the differences, strengths, and limitations of each design. Let's start by exploring why study design matters and how it impacts the conclusions we draw from research. Ready to unravel the world of clinical studies? Let's get started. Before we compare cross-sectional and longitudinal studies, let's define what a study design is. In clinical research, study design is the framework that guides how data is collected, analyzed, and interpreted. It determines the reliability of the results and the types of questions that can be answered. Choosing the right design is essential for obtaining valid and meaningful findings. Now, let's look at the two main types we'll focus on today. First up, cross-sectional studies. These studies observe a population at a single point in time. Imagine taking a snapshot of a group and analyzing their characteristics, behaviors, or health outcomes right then and there. Cross-sectional studies are often used to assess the prevalence of diseases or risk factors in a population. They're quick, relatively inexpensive, and provide valuable insights into current conditions. However, they can't determine cause and effect. Let's see how this works in practice. Suppose researchers want to know how many adults in a city have high blood pressure. They survey a random sample of residents, collect their blood pressure readings, and analyze the data. This approach provides a picture of the current situation, how common high blood pressure is in that city at that moment. The results help public health officials understand the scope of the problem and plan interventions. But remember, this design can't tell us whether high blood pressure developed before or after certain behaviors. Cross-sectional studies offer several advantages. They're efficient, as data is collected at one time point, making them less time-consuming and more affordable than other designs. They're great for estimating the prevalence of diseases or risk factors and can be conducted on large populations. These studies are especially useful for generating hypotheses that can be tested in future research. However, let's not forget their limitations, which we'll discuss next. While cross-sectional studies are valuable, they have notable limitations. Since data is collected at a single point in time, it's impossible to determine the sequence of events. This means we can't establish cause and effect relationships. There's also the risk of bias if the sample isn't truly representative. Despite these challenges, cross-sectional studies remain a cornerstone of public health research. Next, let's shift our focus to longitudinal study. Now let's talk about longitudinal studies. Unlike cross-sectional studies, longitudinal studies follow the same group of individuals over a period of time. This approach allows researchers to observe changes, track developments, and identify patterns. By collecting data at multiple time points, longitudinal studies can reveal how exposures or behaviors influence outcomes over time. This makes them powerful tools for understanding cause and effect. Imagine researchers want to study how diet affects blood pressure. They recruit a group of participants and track their eating habits and blood pressure readings over several years. By observing changes over time, researchers can see if certain dietary patterns are linked to changes in blood pressure. This design helps uncover trends and possible causal relationships that cross-sectional studies can't provide. Longitudinal studies offer unique strengths. By following participants over time, researchers can observe the sequence of events and better establish cause and effect relationships. These studies are ideal for tracking the development of diseases, understanding risk factors, and evaluating interventions. They provide rich, detailed data that can inform healthcare policies and practices. However, they also come with challenges, which we'll discuss next. Despite their strengths, longitudinal studies have limitations. They require significant time and resources, as researchers must follow participants for months or even years. There's also a risk of participants dropping out, which can affect the validity of the results. Additionally, these studies can be expensive and complex to manage. Still, their ability to reveal trends and causal relationships makes them invaluable in clinical research. Summarize the key differences between cross-sectional and longitudinal studies. Cross-sectional studies provide a snapshot at one point in time, while longitudinal studies track changes over time. The former is efficient and good for estimating prevalence, but can't establish causality. The latter is more resource-intensive but can reveal cause and effect relationships. Understanding these differences helps researchers choose the right design for their question. Cross-sectional studies are ideal when you need quick information about a population's current status. They're commonly used in public health to assess the burden of diseases or risk factors. If you want to know how widespread a condition is or identify groups at risk, this design is a practical choice. However, remember its limitations regarding causality and time sequence. Longitudinal studies are best when you want to understand how things change over time. They're essential for studying the development of diseases, evaluating interventions, or exploring long-term effects of exposures. If your research question involves tracking changes or establishing causality, a longitudinal design is the way to go, despite the extra time and resources required. Both study designs use various data collection methods such as surveys, interviews, medical records, or laboratory tests. The choice of method depends on the research question, resources, and population. Accurate data collection is essential for reliable results regardless of the study design. Let's look at how data is typically gathered in each type. In cross-sectional studies, data is collected from participants at a single time point. Researchers often use questionnaires or health screenings to gather information. The process is usually straightforward and can involve large groups. This efficiency is one reason cross-sectional studies are popular for public health surveys and epidemiological research. Longitudinal studies require repeated data collection from the same participants over time. This might involve regular interviews, health assessments, or follow-up surveys. The process is more complex and requires careful planning to ensure participants remain engaged and data remains consistent. Despite the challenges, this approach yields valuable insights into changes and trends. Sampling is a critical aspect of cross-sectional studies. Researchers aim to select a representative sample of the population to ensure the results are generalizable. Random sampling is often used to minimize bias. The size and diversity of the sample can greatly influence the study's accuracy and relevance. In longitudinal studies, sampling involves selecting participants who are willing and able to be followed over time. Retaining participants is a major challenge, as dropouts can affect the validity of the findings. Strategies like regular communication and incentives are often used to maintain engagement throughout the study. Data analysis in cross-sectional studies typically involves calculating prevalence rates and identifying associations between variables. Statistical methods like chi-square tests or logistic regression are commonly used. The goal is to describe the current state of the population and explore potential relationships, though causality cannot be confirmed. Longitudinal studies use more complex statistical methods to analyze changes over time. Techniques like survival analysis or mixed effects models help researchers understand how variables evolve and interact. This allows for a deeper exploration of trends, risk factors, and causal relationships, providing richer insights than cross-sectional studies. Bias can affect the validity of cross-sectional studies. Selection bias occurs if the sample isn't representative, while information bias can result from inaccurate data collection. Researchers must carefully design their studies and use validated tools to minimize these risks and ensure reliable results. Longitudinal studies face unique biases such as attrition bias when participants drop out over time. This can lead to incomplete data and affect the study's conclusions. Researchers use strategies like regular follow-ups and incentives to reduce dropout rates and maintain data quality. Ethics play a vital role in both study designs. Researchers must obtain informed consent, protect participants' privacy, and ensure the study's benefits outweigh any risks. Longitudinal studies in particular require ongoing communication and respect for participants' autonomy over time. Cross-sectional and longitudinal studies are widely used in public health. Cross-sectional studies help identify current health issues and target interventions, while longitudinal studies track the effectiveness of programs and monitor long-term trends. Both designs contribute valuable evidence for policymaking and resource allocation. In clinical trials, longitudinal designs are often used to evaluate new treatments over time. Researchers monitor participants, progress, side effects, and outcomes, providing robust evidence for the safety and efficacy of interventions. Cross-sectional data may also be collected at specific time points for comparison. Classic example of longitudinal research is the study of smoking and health outcomes. Researchers have followed large groups of people for decades, tracking their smoking habits and health status. These studies have provided strong evidence linking smoking to diseases like cancer and heart disease, shaping public health policies worldwide. Cross-sectional studies are often used to estimate the prevalence of diseases like diabetes or hypertension in a community. By surveying a representative sample, researchers can quickly assess the burden of disease and identify populations in need of targeted interventions. One challenge in cross-sectional studies is ensuring the sample accurately reflects the population. Factors like non-response or selection bias can skew results. Researchers must use careful sampling methods and statistical adjustments to address these issues and improve the study's validity. Longitudinal studies face challenges like participant retention and maintaining consistent data collection. Over time, people may move, lose interest, or become unavailable. Researchers must plan for these issues, using strategies like regular contact and flexible scheduling to keep participants engaged. Cost is an important factor in choosing a study design. Cross-sectional studies are generally less expensive as data is collected once. Longitudinal studies require more resources for repeated data collection, participant follow-up, and data management. Budget constraints often influence the choice of design. Time is another key consideration. Cross-sectional studies can be completed quickly, making them suitable for urgent public health needs. Longitudinal studies take longer but provide more comprehensive information about changes and trends. Researchers must balance the need for timely results with the depth of information required. Generalizability of study findings depends on the sample and design. Cross-sectional studies can provide broad insights if the sample is representative. Longitudinal studies offer detailed information about changes but may be limited to specific groups. Researchers must consider these factors when interpreting results. Sometimes, researchers combine cross-sectional and longitudinal designs to maximize strengths and minimize weaknesses. For example, a study might start with a cross-sectional survey to identify trends, then follow a subset of participants longitudinally to explore causes and effects. This hybrid approach can provide a more complete picture. Selecting the appropriate study design depends on the research question, resources, and timeline. Cross-sectional studies are best for quick assessments, while longitudinal studies are ideal for exploring changes and causality. Researchers must weigh the pros and cons of each approach to make informed decisions. The choice of study design has real-world implications for healthcare decisions. Reliable research informs guidelines, policies, and patient care. Understanding the strengths and limitations of each design helps clinicians and policymakers interpret evidence and make better choices for public health. To recap, cross-sectional studies provide a snapshot of a population at one time, useful for estimating prevalence and generating hypotheses. Longitudinal studies follow participants over time, revealing trends and causal relationships. Both designs have unique strengths and limitations, and the choice depends on the research goals. Advances in technology and data analysis are expanding the possibilities for both cross-sectional and longitudinal studies. Electronic health records, wearable devices, and big data analytics enable researchers to collect and analyze information more efficiently, opening new avenues for clinical research. Technology plays a growing role in study design and data collection. Online surveys, mobile apps, and remote monitoring make it easier to gather data from diverse populations. These tools can enhance both cross-sectional and longitudinal research, improving efficiency and data quality. Big data is transforming clinical research. Large datasets from electronic health records or population studies allow for more comprehensive analyses. Researchers can identify patterns and trends that were previously impossible to detect, enhancing the value of both cross-sectional and longitudinal studies. Longitudinal studies are particularly valuable in personalized medicine, where understanding individual changes over time is crucial. By tracking patients' responses to treatments, researchers can tailor interventions and improve outcomes, moving toward more precise and effective healthcare. Both study designs are used in global health research to address issues like infectious disease outbreaks, chronic disease trends, and health disparities. Cross-sectional studies provide rapid assessments, while longitudinal studies track the impact of interventions and policies over time. When reading research, it's important to consider the study design. Cross-sectional studies can highlight associations, while longitudinal studies can suggest causality. Being aware of these differences helps you critically evaluate the evidence and understand its implications for practice. Clear communication of research findings is essential. Researchers must explain the study design, methods, and limitations so that others can interpret the results accurately. This transparency builds trust and supports evidence-based decision-making in healthcare. The field of clinical research is always evolving. Staying informed about study designs, new methods, and emerging technologies helps researchers, clinicians, and the public make better decisions. Continuous learning is key to advancing healthcare and improving outcomes for everyone. In summary, understanding cross-sectional and longitudinal studies is fundamental for interpreting clinical research. Each design has its place depending on the research question and available resources. By recognizing their strengths and limitations, we can better appreciate the evidence that shapes healthcare decisions. Thanks for joining us on this journey through study designs.